So we're going to look at a few techniques for range of motion on a client after finger injury with finger stiffness. Now this client obviously does not have finger injury. And the other thing is that most of the time your finger injuries are going to be your ring finger and small finger. We're just going to show some range of motion pointers and use the index finger so it'll be easier for our camera to see. So get a lot of PIP joint injuries and a lot of stiff joints, extension lags, poor flexion as well, very limited range of motion at the PIP. And in your clinic, at some point you will be doing some passive range of motion strategies for that joint. And you really want to give a lot of stability before you really start, the word we all love, cranking on someone's joint. And so I like to really put a couple fingers here at the MP joint and give a lot of stability before I start doing any significant pushing here. Okay, so we're going to ease into it, then might do some hold and then try to push a little bit further. Do the same thing with some range here at the DIP, and then of course we can do some composite. But if you're going to be applying a lot of pressure to a really stiff joint, give as much stability as you can to the proximal joint here. Okay, you might have a client with after a metacarpal fracture, and you'd be doing some passive motion here as well. Okay, you could do some strategies like an active assistive, where you might ask the client to flex their finger as much as they can. So give us a partial flexion. Okay, and then if that's as far as they can go, I would place my fingers and say, okay, at this point, just relax, and I'm going to hold your place, so to speak, and then let them relax, let them rest, and then see if they can go a bit further. Okay, just see if you can go a smidge further. Okay, going to mark your place again. Okay, and then you would hold for maybe 30 seconds or so. Then you could try maybe a third time, and a lot of times at that point it's going to tire out. They might not can go any further, or they might tell you, I don't feel like I got any additional motion. You could try then doing a little passive motion. Okay, so I'm just going to push a little bit, see if I can get you down a little bit further. Okay, so assuming that you do, I got her down a little bit further. Now I'm going to keep my fingers here, but I want you to engage your muscles and try to hold that position. This is a technique that we use a fair bit in the clinic, and I would not take my fingers away, because when you first start this, the first couple of times, if you were to release your fingers, they probably would not be able to hold their finger in that spot. So just for training purpose, starting out especially, just keep your fingers there. Okay, so those are just a few techniques for some strategies that you might do on a client, and some of them you can teach them to do themselves. Okay, so one of the things that happens in the clinic when we get a stiff IP joint where we have very limited total motion, in other words, the extension is pretty significantly limited, and the flexion as well, and we get so caught up into trying to work into flexion and even trying to work, passively stretching into extension, that we forget that a really good strategy would also be to do some active extension. So you can see if the client could extend up with the finger. Okay, so that's obviously pretty good. The client may not be able to lift the finger very far at all, or sometimes they may not be able to lift the finger, but then if you lift it and then ask them to hold after a couple of sessions, or maybe a couple of trials, they might be able to hold, or they might be able to hold here, versus if you brought them all the way up to this point, they may not be able to. So you can work just active extension. You can work on, if they can't bring it up, do kind of like a place and hold, see if they can hold. They can practice with just a little bit of resistance, so trying to push up against some resistance. Once they master that, you can actually try coming up, and they can do this themselves. And obviously you could overpower a finger, but just give enough resistance so that you really feel that you're working that extensor. Okay, so you can make some blocks This is just a little bit of scrap splint material that I cut and put a little Coban over it for a little padding, and you can show patients how they can do some blocking exercises for their DIP flexion and PIP flexion.